I'm Dr. Erin Kaleta. I'm in the Department of Laboratory Medicine and Pathology, and I'm the director of the Infectious Disease Serology Lab at the Mayo Clinic in Arizona. This was in partnership with the Maricopa County Public Health Department. They reached out to ASU, Arizona State University, and us at Mayo to engage together to do a collaborative project to get at the seroprevalence within our community. It's of public health interest, so they can project how many people have been infected in our city. To use that kind of information for projecting vaccine response and getting a better feel for how many people have been infected. Mayo Clinic ran the antibody testing for all of the patient samples that came in. We got the tubes, they were centrifuged in the field, so processed in the field, and then brought to our lab for all the testing, and then we reported all the information back to public health. The study results showed that 11% of people in Maricopa County have been infected. Which isn't a very high number. We're seeing a pretty comparable number of patients that saw care to other cities. So in our results, we found that about 25% of patients actually sought care. So that means that 3 out of 4 people weren't seeking care and aren't being picked up by the monitoring of PCR results. So now we know that in our county, it's projected 11% of people have been infected. And that's important so that we can look at how many people have not been. So if we think about it in terms of 90% of people have not been infected or exposed, that leaves that population of people vulnerable to getting infection in the future. The first thing to note about the vaccine is that even if you had natural immunity, it still would be wise to consider getting the vaccine. There's a lot of unknowns. We don't know whether natural immunity produces antibodies in all situations, or if the antibodies that we measured, say in our study, are the right kind of antibodies. So the neutralizing antibodies are what really matter. And the vaccine results are showing that they're seeing very positive response in T-cell response and in antibody production for neutralizing antibodies. So there is still value in getting the vaccine, even if you've been naturally exposed to COVID. But one thing we can take away from this is that we know that only 10% or 11% of our population has been exposed. So that still leaves a very substantial number of people that are of interest for the vaccine, people that haven't been sick yet that would greatly benefit from having that vaccine. So it helps us walk into vaccine planning knowing that the majority of people are still going to be eligible and interested in the vaccine. So the way that we modeled this seroprevalence study was to make it as equitable as possible to reduce the bias from various health disparities. So, it's well known that health disparities impact whether people seek out care. And so the point of the seroprevalence study, we went door to door as opposed to having a center open where we could solicit people to come in. When you do that, you set up some sort of bias, a predetermined proportion of people that would come into a site if we were soliciting, as opposed to the door-to-door approach that we took where we were going out into communities and asking for participation. So in this event, we got as many people as possible that would agree to this survey, but it was completely randomized, so we weren't falling into any of the traps of the health disparities issues. From that information, we were able to look at the number of confirmed infections based on people who sought care versus the amount that we saw in the seroprevalence study. And so when you compare those two numbers, we found that only about 25% of people who had that infection were actually seeking care. Which is pretty on par with other cities. We were fortunate in Phoenix and in Maricopa County that our surge happened a little bit later than others. So people were more aware of the symptoms. There was better access to healthcare, better access to testing. So there's been some other large studies that are showing that number is more like 5 to 6 times higher infection rate versus people who sought care. So for Maricopa County to be at 3 to 4, that's actually a pretty good number. Herd immunity is a concept that enough people in the community are immune to an infection such that the virus itself can't transmit from person to person. So if I'm sick and the person next to me is immune, I can't transmit the virus to them. That's how all of our vaccination-ready diseases work. So if a person has, for example, a measles vaccine and they're next to a person with measles, they're not going to catch it. So when we look at our numbers, it all has to do with how transmittable the virus is. So COVID, we're estimating about 60 to 80% of people need to be immune in order to stop transmission of that virus. Right now, being at only 11% indicates that we're not really close to herd immunity. If we were to allow herd immunity to be a natural infection, a significant number of people would get sick, a significant number of people would die, and we'd have hospitals being overwhelmed. So although it's not a terribly high number, hopefully what it would show to the community is that vaccination is going to be very important. It's going to be essential in order to stop this virus from replicating within our community. It's important with these numbers to keep in mind that our infection rate has been quite low. At 11%, that leaves 90% of people that are still susceptible to this disease. So I understand COVID fatigue. A lot of people don't want to quarantine anymore. It has been very hard and very taxing. But we need to keep the ship upright. We need to keep social distancing measures and masking, walking into the holidays knowing all of the different social distancing measures when you're with your family. Maybe reconsider that large gathering so that we can keep this infection under control.